Even when you think you're in control,
Addison,
you're not.
what are you doing here?
Well, you'd know if you bothered to return any one of my phone calls. Hi, I'm Addison Shepard.
Shepard?
And you must be the woman who's been screwing my husband. I was just checking to see if Dr. Burke secured the
Intern, you requested. He did. Blood vessels in the placenta.
Meaning? One twin gets too much blood, the other too little, endangering the lives of both. I'd expect you to know that, Greg.
They told me there wasn't much.
So we're going to get you into surgery tomorrow. If you have any questions at all, please ask Dr. Gray. From what I have seen, she is one of the hospital's most popular interns.
I could have answered your question had you given me the chance.
Chin up, Gray. I'm this tough on everyone, not just the women my husband sleeps with. Order an ultra.
Would you shut up?
Dr. Shepard.
Yes.
Labs confirm what look like abnormalities. On the ultrasound, I think you should come and see for yourself.
Fine. Let's go.
Meredith.
Don't. With evidence of subcu edema.
How you doing there, Gray?
Good. I'm good.
And Dr. Gray will be back to check on you a little bit later.
Actually, I'd prefer it if Dr. Gray were taken off the case.
Why? Is there a problem?
Just reminds me of someone I don't like very much. Someone my husband likes a lot, particularly in lingerie. You understand?
No, I don't understand.
Well, she is sleeping with your husband, right?
Miss Phillips, I lack Dr. Gray's class and patience, so let me set the record straight. My husband didn't cheat on me, I cheated on him. So the wronged woman here, Dr. Gray. So I think you owe her one hell of an apology. Dr. Gray, may I speak with you for a moment?
Don't look at me for help.
I assume he told you why he left me?
Dr. Shepard, with all due respect, this has nothing to do with me.
Really? So you didn't take him back? Good girl.
And in the future, I'd appreciate it if we could keep our relationship strictly professional.
Meredith, sometimes people do desperate things to get someone's attention. There are two sides to every story.
The father's an alcoholic.
Well, isn't this cozy? Can I join in, or are you not into threesomes? I have to go.
Meredith. You really are Satan. You realize that, right?
Doctors?
Dr. Montgomery Shepard.
How old is he?
He's 26.
Survivor, huh?
And then some.
I've seen one case like this before in a 9-year-old. We ended up having to do a total pancreatectomy.
I'd be honored to take any help you can give me.
You're a neonatal specialist. This isn't your area. I'm just saying,
I did 2 years genetics research in cystic fibrosis. I've pretty much seen it all, Dr. Gray.
Oh.
Well, nothing like a domestic dispute to liven up a pre-op, huh?
Where do I sign?
Here for consent. And here. Good. Okay, lift up for me.
It's hard to accept the end when you're too close. Look, I don't want someone who doesn't want me, Meredith. But if there's the slightest chance that he does, I'm not leaving Seattle. Has anyone seen Dr. Shepard this morning?
His name's on the OR board. He should be here somewhere.
To hear it, you know, officially. But, hey, why was that stick blue?
for starters, she falls for the one guy she knows she can't have. Then she blames fate for her own bad decision.
Hello, Dr. Gray.
Hello.
What happened?
She had an apneic episode. She's still not breathing on her own.
Let's intubate and give her surfactant, push 0.1 atropine, 3 milligrams of ketamine.
Meds are in.
Tube. Okay, place the CO2 detector.
She was doing fine with the chest tube.
That's the thing with RDS cases. So when you think the baby's getting better, you slip right back. Rest sounds equal. Good.
Hey, Doc. Hey, buddy. Welcome home.
Oh,
How are you? Yeah.
beautiful. I brought his toys.
Oh, here's his food and his water.
Okay.
Here. Thanks for doing this. I know it's a lot to ask.
It's all right. It's just a dog. Right? Come on, Doc.
I miss him.
He misses you, too. You should come visit. The dog. I mean.
I'm walking away now.
So,
And insisted on visiting it to rub its nose before every exam. Step on a crack, break your mother's back.
call it Greg.
The last thing we want to do is offend the gods.
Time of death, 8:17.
Meredith, thank you for your help this morning.
Oh, thank you, Addison.
Yeah. Thank you.
Hey,
Hi.
hey. Oh, hey. Hi.
Hi.
I, have to.
Yeah.
Yeah.
I do too.
Yeah, I got something too, so. Hey,
Hey,
I'm sorry to hear about your patient.
thank you, Addison.
And that life works in mysterious ways.
You celibate? I just don't buy it.
No more men.
No more men. Really? You? And I'm asking because we're friends.
Every guy I meet turns out to be married.
Oh, ouch.
Sorry. Or Mark.
Okay, I'm gonna go over there now.
Sorry. Or
Molly, this is this is Meredith. She's going to be continuing your prep work and taking your vitals. Okay?
okay.
So is there something going on?
No.
Did you guys have a fight or something?
No.
So, we're all still friends?
Yes.
Hey,
Hey,
have you seen Dr. Krev?
hours ago.
Okay. Sorry, I'm not sorry. I'm having a little trouble because I need to ask you something. And I don't usually have trouble, but what I need to ask, I'm not even sure I want the answer to, but I have to ask. So I'm just gonna ask you, and then you answer, and then I'll go from there, okay?
Okay.
Are you sleeping with my husband?
Not since before I knew he was married.
Okay. Except, it felt like in the vet's office this morning and then again in the elevator, it felt a little like you two were having a lover's quarrel.
No, we're not. I've moved on.
I'm dating Finn.
You're dating the vet. Okay.
Addison.
No, thanks. I'm good. Thanks, I'm great. Maybe what I should do is go out on a date with the vet, because that seems to be something that sends you into a blind rage. Oh, but wait, that won't work either, because I'm not Meredith Grey.
Don't denigrate the competition.
I have nothing but respect for Dr. Dandridge. Shows courage to war.
Megan!
Oh, hi.
Weren't you just up on 3?
I was. We lost a patient, a little girl, and I was just...
Why don't you pick a floor and stay on it, and I'll pick a floor and stay on that, because I really need a moment or two without you. Your face shows up in my head, your panties show up in my husband's pocket. Really, you're everywhere, and I need a moment or two without you.
I get that.
Thanks.
Addison. Dr. Montgomery Shepherd?
You bellowed, Dr. Gray?
Hi.
You certainly are, aren't you? But you're not pregnant.
No. Are you okay?
Fine. How are you?
I'm trying to choose between 2 men.
Okay, well, good luck with that.
How did you know Derek was the one?
Excuse me?
I know you hate me and all, and you don't owe me anything. Nothing. No-thing. What was I saying?
Derek.
Right. I want him to be the one. But I would know if he was the one, right? You knew, right?
You don't. I didn't know. I just. Derek's the kind of guy. I just knew he wouldn't hurt me. Not on purpose, anyway. Not the way I hurt him.
He hurt me when he chose you.
Well, I should have let him go. I should have stepped aside, been a better person. I should have. A lot of things.
Me too. A lot of things.
I don't hate you.
How come we never talked like this before?
The only reason we are talking like this right now is because I know you won't remember a single word of this once the drugs wear off.
Were you just talking to Meredith?
Yeah.
What?
Don't hurt her again. Dr. Gray, welcome back.
Thank you.
And, it's just Montgomery now.
What?
My name. The divorce was finalized this morning, so Montgomery. To add to our fun, we've been asked to consult on a case where a woman has a foreign object stuck inside of her.
For lunch with your ex-husband still attached.
We get together sometime.
Dr. Bailey, can I have Gray?
You can have them all.
Something you needed, Dr. Montgomery.
Now, this is none of my business, but I just thought you might want to be warned.
I'm sorry.
Your sister Molly's just been admitted for an emergency C-section.
Molly's not my sister.
Okay, but technically she is. You have the same father. And Susan...
Susan Gray is definitely not my mother. I appreciate you trying to be nice and everything, but I really don't even need to know this. So...
Actually, you do.
Dad visiting Lexi. We thought we had a lot of time. I mean, Molly's only the contractions, but I guess the baby is ready to come out.
Well, do you need anything else, or
Yeah, actually, I could use an intern for this. Can you ask Dr. Bailey for someone?
I'll do it.
You sure?
Yeah, I'm fine.
Okay.
It'll be so nice to have a familiar face in the operating room. Thank you.
How you doing there, Molly?
Okay.
4 minutes.
Dr. Gray, can you get...
The warmer's ready when you need it, Dr. Montgomery. Response to stimulation.
Gray, you want to talk her through this?
Let's try suction.
Gray, I need your help here. You left me hanging in there, Gray.
I'm sorry. I'm sorry. Do you need me to scrub in on the baby?
No, I want you to keep Molly and her mother apprised of the baby's condition while I operate.
I'm sure they'd rather talk to you.
The baby's got jejunal atresia. She may die. I got consent, but I don't have time for updates.
I think I would really learn a lot from observing this procedure.
It was a mistake to let you in the OR with your family in the first place. It's not gonna happen again. Check in with me every hour.
You're still here. I went to NICU. I thought you'd be done.
I'm having trouble with this anastomosis, and I still have to take a look at the distal valve.
What should I tell Molly?
I don't know. Tell her I'm doing the best I can. I don't know.
Back day systole, keep compressions going.
Oh my God.
She's hypothermic.
How's her temp?
Only up to 81 now.
Come on, Meredith, don't do this.
Push another epi. How many is that?
This is our 4th round, sir.
Been here 20 minutes, sir.
Still in a systole. She's breathing out her own?
She is.
She's been down a long time. Do we know the brain function yet?
I don't know.
Derek does.
I haven't paged him yet. I wanted to... giving her more time.
Hey!
Oh.
Hey! 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 Here, you! Woo! Wow, it's great to see you guys.
How's LA?
Oh, it's great. It's fun. You know, it's the sun and surfing. It's...
You surf?
No, I don't surf. Oh. So anyway, hey, look, I hugged you there. Did you see that I hugged you? You stole my husband from me. I hugged you. I mean, I've grown. I have, and I can be happy for the happy couple, right? I'm all LA and like one with myself, so I feel really, yeah. Okay, well, I'm gonna go save a life now. Okay. Really great to see you. Really, cheers.
Hey, you leaving already?
I have a plane to catch. I walk on the beach now. I buy aromatherapy candles. I'm very zen. But I want to kick your ass so badly right now. It is killing me.
Excuse me?
I'm talking about Derek. Derek Christopher Shepard. Are you letting him get away? Because I swear to God, Meredith, if you let him ride off into the sunset with that doe-eyed little thing...
Okay, secure.
Meredith, Karev, can you go get Jen's blood test results? Give me one reason why I shouldn't go to the chief.
Why? The surgery was a success.
He made a mistake in her first surgery. He caused a series of complications. He feels responsible. So tell me why I should worry less. Tell me why I shouldn't go to the chief.
During the clinical trial, he lost a lot of patients, and it affected him for the better, I think. I mean, he cares more if that's possible. You just have to trust him.
Okay. Meredith.
Derek, look at me.